And action. Okay, Jim had a question about shin splints. So I'm going to do my best to show what a shin splint is, and also hopefully show what the value is of flexibility, stretching, preseason conditioning. So I kind of gave away the end, but anyway, this is a shin. This is the tibia, this is the fibula, this bone on the outside, the tiny bone on the outside. This is the talus underneath that house of the ankle. And this is the femur with the little patella, or the knee. The reason you have muscles along this long bone are to either move the ankle or move the knee. Move the ankle or move the knee. And this is just a conduit. This is just a place where the muscles sit. And the muscle, there are 4 muscle compartments within the shin, within the anterior leg. And the 4 muscle compartments have a limited amount of space. So when you have, say, a lot of exercise, most of you have experienced it. When you lift weights, you get swollen, as some guys refer to it. You get swole. And the muscles feel really big and beefy. When you do a lot of running, your legs feel thick and muscular, but tight. So that's because the muscle has been asked to do a lot of work. When the muscle is asked to do a lot of work, it has a ton of blood flow, and there is a little bit of damage, but it's already on its way to getting stronger and repairing. But the problem is with the compartments that are in the leg, when those compartments, when the muscles get worked in each of those individual compartments, say from doing steps, or doing interval training, or preseason conditioning, or the first run of the season, when your muscles aren't ready for it, they'll get full. When they get full, they get swollen. When they get swollen, there's hardly any room because think of it as a saran wrap wrapper. It will not allow excessive amounts of size. So what happens is the muscles feel tight. But what's more important is the nerve that goes through the muscle bundle, like this one, the nerve and the blood supply that goes through that, those are delicate little tissues. And the muscle is not a delicate tissue. Muscle will be full. It'll push and squeeze the blood vessel that goes through here to choke off the blood supply. Or if there's a nerve that's supposed to take care of sensation, it'll choke off the nerve. And you'll now have not only a full feeling, you'll have almost like a paralysis. You won't be able to lift your leg up. Or you'll have ischemia, and it'll be painfully crampy. And your muscle will eventually just tell you, I'm not going to do any work because I'm not getting any blood flow. And then suddenly you hit the wall because of pain. But that's what happens in a shin splint, also known as medial tibial stress syndrome. The worst case scenario is that shin splint might actually be a fracture to either the tibia or a fracture to the fibula. It's up to one of us to check. Sometimes there's an old-fashioned test you can do. You do the tuning fork test, and if the tuning fork gets vibrating properly, causes pain to come out more, that usually means that there's a fracture. Sometimes even an ultrasound. Best thing is bone scan or x-ray, but I digress. The important reason with talking about shin splints is to understand the theory. So if you understand the theory that the muscle gets too swollen and chokes off its own blood supply within that old saran wrap capsule, it's a bad feeling. And before the muscle dies, it's going to send to the brain excessive amounts of pain sensation. So what do we usually do? We walk around and say, oh, that hurts. And then usually walk off the track or walk off the court. And you survive because you stop, because you listen to the pain. Some folks who are in fight or flight because they're in a competition, they won't stop. And it'll get worse. And it gets to the point where they get off the court and suddenly, oh, it's agonizing pain, severe pain, paralyzing pain. So that's the typical thing with a shin splint. How do we avoid that? Well, number one, working on flexibility. So if the muscle is flexible, if the muscle has been given some stretching routines to do every day, then theoretically you actually get the blood flow to be constantly flowing, even more so than usual before your activity. That's called the Trepp effect. Trepp effect, I don't know if anybody talks about that anymore, but when I was in high school in the 80s, I used to always study the Trepp effect in physiology to figure out how to get my I used to be the captain of the track and field team, and I would always warm everybody up before our practices. And we tried to do head-to-toe stretching. And the reason for the stretching was to prevent cramping and to also bond as a group. But the weight guys, the shot put, the discus guys would always say, why am I doing this? That's because you can perform better no matter which event you're in. But having a good flexible muscle, even preseason, would be important. Having a preseason conditioning is very important. If the muscle is well versed with what to do when it gets into that sudden event, then obviously it's not going to swell up that much because it's not even it's effortlessly going. Kind of like watching Michael Johnson or watching Usain Bolt do what they do. It's almost like they're effortlessly going. That's because of all the training. It's just definitely because of the genetics, but it's also because of the training. So if you have a lot of training, muscle won't swell up that much. It'll be effortless. So preseason training, one thing. Stretching before the preseason training and stretching during your event and your season, also very important. Sometimes having a very good blood flow in the area, also very important. So if you have high blood pressure, cholesterol, diabetes, the blood flow will be hampered, and sometimes that will set you up for an injury or the pain. So it's important to always stay healthy with your nutrition. In addition, sometimes when you do have the mechanics of the foot off, if the foot is constantly torqued up, dorsiflexed, if the foot is always dorsiflexed because you're using the wrong kind of shoes, then it has to constantly lift up aggressively more than usual instead of just lifting up every once in a while with a stride. You got to clear to get past the cushioning of the shoe. So having really good orthotics and or shoes that are matched up for the arch of the foot are very important. If you look at Runner's World, if you go to any running stores, to get fitted for shoes, they want to see what your foot looks like outside of your shoe. See if you're pronating, if you're supinating. I have a great podiatrist, sports podiatrist, Bob Weil, who is excellent with his orthotic construction. He gets Olympians to work better. I've just sent him a hopeful Olympian in race walking, but we'll see how she does. But anyway, I can't stress enough about the importance of the foot and the mechanics of the foot in the shoe. Well, the surface is also important, but that is hard to control, but the shoe definitely. So it's important to know that. It's important to have the ankle and the knee in its top tip shape and watch out for diseases or problems with the kinetic chain. Now the kinetic chain, or talking about alignment, that's that Q angle I was talking about. Sometimes if there's more, if the foot has to be twisted in more than usual because of the wrong foot, then it sets up for a bad Q angle, which also causes strain to one side more so than another side. I'm not going to get into that too much. The basic premise, Jim, with regards to your problem of shin splints, even if you're playing on the court now and it's a league, you would still have to, as best as possible, to have your shoes looked at, have your feet looked at, have a relaxation or a stretching routine that you always do season in and preseason and postseason. I think it would make you a better player. And most of all, having some form of flexibility. So hopefully this helps, but this is why we always try to stress, if you have a thing that you're suffering from, even if you can muscle your way through, you call out a timeout for third quarter and you sit out and then you get better again and you go back in. What better way to get all 4 quarters in or play to your fullest than to work on some deficiencies, take care of some imbalances, maybe get an orthotic, and even perform better than you did before. Most of all, not suffer. So hopefully this helps. Good question, Jim. Now don't forget to subscribe to me for my other questions at Dr. Rick's Minute Clinic.